Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about certain progressions that you can do with regards to tennis elbow and the strengthening component in terms of treating this. But before I begin, please hit the subscribe button below. So with regards to tennis elbow, I'm going to assume that during your rehab for this rehab that I'm talking about is sort of the middle component, I would call it, in terms of the rehab process with tennis elbow, in terms of strengthening progressions. So normally, before I get to this stage, number one, I would have recommended some form of stretching typically for this particular area, maybe some self-massage in through the actual tendon of the lateral epicondyle. I might have suggested the use of a band and activity modification to minimize and or eliminate positions and activities during the day that might provoke symptoms. So this would include things like lifting, especially heavier items, gripping type of activities, opening a door with that hand. So I'm going to assume at this point, right, that the irritability, the pain, so to speak, has reduced, and that there's also potentially been some isometric exercises that have been introduced at this point. So isometrics would essentially be just gentle pushing on the wrist with elbow initially bent and then moving towards an extended position, right? Using the opposite hand as resistance and not provoking pain. And also I typically actually have patients use their brace while doing this exercise, and the reason for that is just to offload the tendon a little bit and not to provoke that really localized pain coming from the insertion point. So again, I'm going to assume that at this point the patient is able to do that more or less pain-free. Their pain level has gone down significantly with day-to-day activities, and we're now ready to progress in terms of resistance with movement. So the two movements typically, right, that we find is painful with a tennis elbow is going to be wrist extension, right, and also supination, which is this movement here. So what the studies show is that eccentric contractions are typically the best with regards to tennis elbow. So an eccentric contraction, essentially what that means is a contraction with the muscle in a lengthened position. So what I'm going to show you here is doing this for wrist extension and supination with a resistant band. So I've got my band here. Now normally I'm gonna show you with my arm in this type of position without support. Normally I'd recommend that the patient has their arm on some kind of a table, right, for support when you're doing this, and to actually isolate with the other hand typically on top. Now if we're doing an eccentric contraction for wrist extension, what we'll do is we'll have the patient passively, right, bring the wrist into an extended position, and then to slowly, right, bring that down. So that's what an eccentric wrist extension is going to look like. So starting up, slowly going down. For supination, right, I'm going to start in a supinated position and I'm slowly bringing back. Okay, and then what I typically recommend is that patients start with elbow bent because it puts the least amount of stress on the tendon. Again, I'm a little conservative with this. I like people actually wearing the brace to take a little bit of pressure off and see how they're able to tolerate that from a pain perspective. So I would do that with brace on, elbow bent, starting with elbow in a bent position and then moving to elbow extended. If that's pain-free, then I would move to seeing how it feels, brace off, elbow bent, then going into that extended position again. And then typically 3 sets of 10. The research also says that you'll want to have one day where you do those exercises and then typically 24 to 48 hours without doing the exercise to see how see how the pain level is. So you don't want to necessarily be doing this every single day. So you will want sort of a 24 to 48 hour break in between. So you may be doing this 3 to 4 times a week. If you have any specific questions, concerns, feel free to leave a comment below. And again, please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.